On the phone is Dr. Clay Hayes. Dr. Hayes is president of Mississippi State Medical Association. Good morning, sir. Welcome back to the program. It's good to have you.
Thanks for having me.
There is so much going on. I know you, as everybody else, a lot of other people, listen to the stay-at-home or shelter-in-place order. Your thoughts of where we are now?
I think it's a great idea. I know a lot of the mayors are doing this order, and then obviously the governor did that for the whole state, and I think it's an excellent idea. We still have not hit the main portion of the wave, and so many people are asymptomatic with this virus that the potential for spread is tremendous, and so I think it's a great idea. And I think we should follow those directions really to the T, because what happens is people get closer together, they spread the virus unknowingly, and that's just not good for our state.
Yeah. I think one of the scariest things about this virus is the stuff we don't know about it. And that's driving a lot of the stories that are on media and other places. And it is the biggest concern about the things that we don't know.
That's exactly right. And, one of the biggest concerns is just the healthcare workforce, because the providers are being exposed and they don't know it, and then the viral load, the amount of virus they're taking in, can be tremendous, and that's what will take out our workforce. And so we really have to protect our healthcare workforce so we can take care of the patients that really do need our help. Yeah,
I had Dr. Tim Alford on yesterday, and that profession has something to do with almost like talk show host. We are in the senior citizen. There's a lot of doctors out there who are, in a little bit of overtime as far as retirement's concerned, because they enjoy what they're doing, and we don't need them to go down.
Yeah, that's exactly right. So the highest risk group, if they do get it, is people that are over 60, and we have a lot of doctors in our state that are over 60, and we're trying to protect them. I know in some of the local hospitals, we're keeping them out of the hospital to try to keep them in sort of reserve. They're doing more telemedicine visits, while the younger physicians are in the hospital taking care of the potentially higher risk patients.
Let me ask you the question, your thoughts on this, mask or no mask?
I think masks are good. The challenge is just the supply. And, people are getting very creative about making masks, and I think that's a good thing. Particularly in the hospital, I think masks are very useful. And the one thing is, masks, people are worried about the virus coming to them. Actually, the mask is really good at preventing virus from coming out of you. So if you unknowingly are contagious, so to speak, and you have the mask on your face, you're not spreading as much of the virus around. So, I think masks are a good idea.
Could that be also used, and I tweeted it out, Rhino did a great job making his own mask, and he shared that on social media, and I tweeted that out, and also I think I put it on Facebook. But does it have to be that complicated of a mask just to stop that? Could it be just as little as a T-shirt or a handkerchief?
Well, there's different types of filtering capacity of any mask. The N95 mask that people talk about on television is obviously the highest quality, but also of the most limited supply. And those masks really ought to go to healthcare providers. But just, a basic mask, or if you want to make a mask, that helps a little. It's not going to help a tremendous amount, but it does help a little bit.
I think the number one thing, I hate to beat this in the head of everybody out there, but it's important. I think the number one thing, wash your hands.
Absolutely, and because this virus can be on a surface for a long period of time. We talk about the New England Journal of Medicine published a paper recently, talked about the virus can last on a piece of cardboard for 24 hours, on a piece of plastic or steel for 72 hours. So washing your hands and also wiping down surfaces with alcohol wipes, and that's a very important thing. And it doesn't necessarily always have to be alcohol. These people use hand sanitizers. Good old soap and water for 20 seconds can do a lot.
I think about that. No wonder New York is having the problem that they're having when you talk about all the the stair rails and the escalators and the elevators. Everything is stay on stainless steel or chrome or things like that for 72 hours. That's a little bit scary.
It's very scary. We talk about this. Your cell phone can have all these viruses. So wiping down your cell phone periodically, even your own steering wheel in your car, that sort of thing. People coming in and out of their car, but the more we try to stay clean and wipe things down and have the distance between other people, that'll go a long way. And just staying away from other people. That doesn't mean you necessarily have to stay inside your house the whole time. If you want to get out and walk around your neighborhood, you can do that. You just need to keep your distance.
You know what? I just thought about this. Next year, we're going to see a lot different here. I just think we're going to see the flu season for years to come. I'm not going to say we're going to eradicate it, but I think people are going to, regardless if it's COVID-19 or the next flu strain, I just think we're going to change our habits. We're going to change the culture there, and we're going to be so proactive. We may see benefits in the next flu season or flu seasons to come.
No question about it. People talk about vaccines. This isn't, while the medical profession talks about the importance of vaccine, just think if we had had a vaccine for this, how much better we would have been. Mm-hmm. But, we're going to get a vaccine. There's no question in my mind. But this is why we need to make sure we have vaccines for this type of contagion. So we can't stress that enough.
But I don't think we've heard anybody, all the interviews I've done, and again, Dr. Clay Hayes, who's president of Mississippi State Medical Association, I don't think we've had any interviews that people said there's some therapeutic, there's something over the counter, there's something doctors can give you to make you feel better if you're battling with this at home and you're not at the level of going to be admitted to a hospital, whether it's Theraflu or anything else. Have you heard anything that would ease the aches and pains?
Not really. I mean, people, it's just rest. Obviously rest is very important. People can use Tylenol. That would be fine. But, just a good diet also helps a lot. Just the basics, fruits and vegetables and try to drink fluids as best you can. You don't need to overdose it. I mean, you don't just need to drown yourself in fluids, but, rest and eating a good diet, that goes a long way.
Well, that's why we kept the liquor stores open when liquid is important. I got to ask you a couple of other questions. Can you hang on for a second?
Sure, absolutely.
All right. Back with Dr. Clay Hayes, and Dr. Hayes is president of Mississippi State Medical Association. John Pritchett, CEO, Mississippi Center for Public Policy. Lots to talk to him about. That is coming up at 8:05. Shall we take a brief respite for a shopping trip? Virtually, of course, from some of the best VIP sponsors on planet Earth. Let's come back to Dr. Clay Hayes on the VIP, Trustmark VIP Gallo guest line. The unemployment numbers have just been issued. How in the world could we go do this? Who could have thunk about this? We went from the lowest in American history of unemployment. The new claims have just been issued, 6.6 million unemployment. The good news is the Social Security recipients will get that stimulus check. It'll be deposited automatically in your account. Some people were asking about that. Dr. Clay Hayes, president of Mississippi State Medical Association. Can you believe that? 6.6 million people out of work now?
It is something.
It's unbelievable.
It is absolutely amazing. But fortunately, I think people are coming together. This is a time, nothing like a crisis to pull people together. So we're pretty tough folks, and we'll get through this.
I think the psychiatrists who are part of the Mississippi Medical Association are going to have their work cut out for them.
They're busy.
Because there's a lot of people depressed, and I can understand why. Especially, it's almost like a sudden death in the family. You didn't have a chance to get to normally or slowly move into the situation where we go from the lowest unemployment in history to 6.6 million, a record. Now, a lot of that's going to be mitigated by the time June gets here, July, and hopefully by the fall. A lot of the people who are not working are going to go back to work, and the stimulus is going to certainly help. So let's not forget about that. If you're trying to find some bright spots, those are the bright spots. But the only way, and I think you'll agree with me, for us to do this is isolation.
Absolutely, because we could reinfect ourselves. That's the challenge, is that we don't know who the asymptomatic carriers are right now, and when people congregate together, that's a really challenging problem. Recently, my son was at a wedding where several people got infected, and so we self-quarantined him and that sort of thing. These are the questions we're worried about.
What are you getting as the president of Mississippi State Medical Association? What are you getting from the hospitals? What are they telling you?
Well, we're trying to communicate with them almost on a daily basis and encourage them to make sure that they let people know what's going on. I think that's the question and concern from the healthcare providers, making sure we're all on the same page, and they're doing a good job. We had several members of our leadership yesterday met with the leadership of the Hospital Association and trying to have that open dialogue to make sure we know where the resources are too. That's also very important, so we can work together, because it's all about the team. And I tell you, I can't give enough credit to the physicians and the nurses in particular. They're right on the front lines, and we hear you. They're worried, and they're worried not only about themselves but becoming a carrier and infecting their families. And I think it's important to talk about these masks and making sure they have the proper PPE equipment that they need. I think that's super important.
From the news conference yesterday, we heard from Colonel Michelle and others, and we were talking about the availability of masks. It's simple mathematics. What we're trying to do is slow this curve down, and if the curve gets ahead of us, we don't have enough ventilators. Right now we do, but the good news is if we can slow it down, we have more ventilators coming, we have more masks coming, and I mean that's the same for every state in the union right now.
That's exactly right. Everybody has the same issue, and as the governor mentioned yesterday in the press conference, we're competing with each state. And again, if we can flatten the curve, if we can slow this down, we can get ahead of this. Because the companies are ramping up, they're stepping up. We even have a company here in Mississippi that's repurposed itself so they can make masks, and they just got to have time to produce these masks. And the more we can prevent the infection from spreading out in the community, the longer, the better our chance we have of getting these masks in place to the people that need it.
What are some of the physicians telling you, Dr. Hayes, about chloroquine? Is it available for most of the hospitals out there?
That's a good question, and I don't have the numbers of availability. I know that the Board of Pharmacy has restricted its use. And you got to remember, chloroquine is used for other purposes, and the people that we know.
Wait, back up on that. When the Board of Pharmacy has restricted its use, meaning what?
Well, like for example, if you call a local pharmacy and you write a prescription for it, you've got to give a good reason for it. You can't everybody can't come get hydroxychloroquine or chloroquine. There has to be a good reason for it. And right now, the outpatient pharmacies are not using, because we're going to run out, and for the patients that need it, we're going to run out of the supply. So we're really trying to keep it, if it does work, and again, the studies are ongoing, we don't know for sure that it works. We think it may work, but we don't know for sure.
Well, in any of these, though, isn't it a possibility, just like the virus itself has a different attack on some people, all the way from death to some people think it's a mild flu, it could not chloroquine work differently on different people and their metabolism or whatever it is?
It might. We don't know. That's why we do research. So we don't know the answer for sure. Again, it might not. We just don't know. Why
would a Z-Pack be that required, or they think that helps?
Well, it's a theoretical, the way that the virus, sort of the makeup of the virus, trying to make this simple, potentially the Z-Pack could potentially kill the virus. But again, these are all questions we're trying to investigate, and we just don't know.
Do you have any doctors out there or any areas where there is a shortage, and you're asking some of the, not only doctors, but nurses to maybe forget about retirement for a while and come back?
We're not there yet. We're thinking about that option. If we get to a situation where we're having healthcare providers that are sick and have to come out, then we have to look at other options. So we're looking at that. We're not there yet, but we're definitely looking at that.
You have, let's see, yesterday we had 136 more, so we now have 1,073 cases. We have 22, we had 2 more deaths yesterday. We have 22 people dead in the state of Mississippi attributed to COVID-19. Our 1,073 cases in the state adds up in that total of over 200,000 across this country, and we are up to surpassing 5,000 deaths. Still, when you look at flu, whether it's the swine flu or whatever it happened to be, those numbers are nowhere near what those epidemics had. But I don't know. We're adding sometimes 1,000. I heard 2,000 per hour nationwide. So we hope it's not going to be that many.
You're exactly right. And, we talk about these numbers, and this what is, we talk about the humanism of this. These are actual people. These are not numbers. And, I feel sorry for the patients and their families that have had a death or maybe a loved one sick in the hospital right now. We really need to think about that. And so that's the importance of making sure we don't spread this around our communities, because it can get, these numbers are going to only go up for the next few weeks. We'll get over this at one point, but the more we do about getting away from each other, practicing social distancing and washing our hands, we don't want to have this number to go exponentially up. We've got to do something as a community, and that's what people ask, what can I do? And these are the things that people can do, because, again, these are not just numbers. These are people.
Well spoken. Always good having you, sir. Appreciate it very, very much. Look forward to getting back in the studio someday soon.
Thanks so much for having me.
Dr. Clay Hayes, President, Mississippi State Medical Association. I think the hardest thing is now we're getting more reality to find out that this is probably going to be all the way with us all the way through June. That's 2 months through June.